Good morning to you. Just after 9 a.m., I'm Jane Monreal. You are watching Live Impact News here on WCNC Plus. We have a full show for you this morning. We'll get to some of our local news here in a minute. But first, we want to talk to our special guest right now, North Carolina Senator Ted Budd, joining us now to discuss several significant developments from Capitol Hill. Senator, nice to see you again here on Live Impact News. I know it's been a busy month. Appreciate your time.
It has, Jane. Thanks for having me, Jane.
All right. I know we've got to talk about health care, securing a long-sought victory for the Lumbee Tribe, as well as voting on this annual defense bill as well. But let's go ahead and start with health care, Senator, because of these Affordable Care Act tax credits, the subsidies that are set to expire in less than a couple of weeks now, and that will affect up to 900,000 North Carolinians. Potentially doubling their premiums in 2026. What are you telling families how they can operate after if the subsidies do expire without a vote?
Well, let's remember in North Carolina, 81% of people are very satisfied with their current health care plans. I mean, we'd like all prices to go down. We're working on that. We've got the right agenda. But 81% of the people are happy. And the ultimate goal is to have quality health care at a reasonable price. But if you go back to 16 years ago, almost to the very week, that's when Obamacare passed. It was called the Affordable Care Act. But if you have to subsidize it, which they had to do a few years later, it was never affordable to begin with. So essentially the Democrats broke health care 16 years ago. They propped it up with subsidies, and then they went and set the dates for those subsidies to expire. That's what's happening. It's not the COVID era Biden bonuses that people are talking about right now. Those were put in for a short-term period of time, and of the increases, only 3% of that is due to the Biden era COVID bonuses. So that's insignificant. But what we do, we have solutions, and that we're working on these, and that is buying insurance across state lines, short-term health care plans, price transparency. So when you go to the doctor or you're admitted to the hospital, you actually have a menu. You know what the prices are. We think those are great things. And what Obamacare did is it sent money to the insurance companies. And that's why if you look at their stock prices over the last 16 years, they've gone up, up, up. So they've gotten wealthy at the expense of American taxpayers. It was a horrible system of bad incentives, and it's really caused healthcare to get out of reach for so many people. So with those 19% of people in North Carolina, we want to get better incentives in the system. We want to give them health savings accounts so the money gets sent to them and not insurance companies, and that they have choices for themselves and for their families.
And so once this expires at the end of the year, what does day one, January 1st, look like for North Carolinians then, if there's nothing in place?
Well, for most of them, they're going to be just fine because 81% of people are fine. The COVID era Biden bonuses are what's expiring. That's 3%. And I would say most people in the state are going to be just fine.
Okay. You've introduced the COMPETE Act, which you and Senator Cruz have talked about. And you've hinted at what that includes. Break that down when it comes to things like prescription drugs, maternity care, pre-existing conditions.
Well, when it comes to short-term insurance plans, we want to give people an option. They can buy them across state lines. They can have 364-day plans, and then they can continually renew them. And they can use what fits for their families. Pre-existing conditions, it's part of we absolutely have to take those into consideration. There are people with long-term comorbidities, for instance, diabetes, type 1, type 2. We have to make sure that those are included, and I think that's something that all healthcare, anything that we do in the future, has to make sure that we take care of.
All right, and then when it comes to prescription drugs, again, that is across state lines?
Well, that's not necessarily across state lines. I mean, that just gives people the full market options. But I do have some biologics, biosimilar legislation. I mean, those are things for for MS or arthritis and other very devastating diseases. And those medications are so expensive. They can be thousands and thousands of dollars per month. But if we introduce my Biosimilars Act, what it does, it allows us to speed the process in the FDA to approve those, and then that introduces more into the market. And we've seen cases where biosimilars have been introduced, And by the way, North Carolina is a great place to make these. We've got a major industry around Raleigh-Durham area and across our state for biologics and other pharmaceuticals. But if we introduce biosimilars, we can save thousands and thousands of dollars per month per patient. And I think that would be a great thing for our country and for North Carolinians.
Absolutely. When can we see some kind of bridge or the next move into what our healthcare system will look like then?
Well, we're introducing options every week. I've introduced the biosimilars medication already. These would be teed up for a vote. We're still in the 119th Congress. That'll go through the end of next year. So that's our focus. When we start in January, we're going to be looking for solutions to introduce these to the American people. But remember, in the Senate, it takes 60 votes to get most of this done, unless we do it through reconciliation. And then it has to be a certain amount of or types of legislation that passes on a 51 vote legislation. So again, it's a very narrow window if we use the 51 vote rule. It's a broader window if we use 60 votes. So we'd love Democrats to join us on some of these things because we think they're great for our country. It puts more money in people's pocket and it lowers the price of health care and it increases the quality and options that people have, and that's the Republican goals.
Another good news for North Carolina, of course, is the passage of the Lumbee Fairness Act, part of the defense bill. Wow, has this been a long time coming or what?
This has been 137 years of seeking recognition. They were partially recognized in the 1950s, but this gives them full recognition. These are 60,000 great individuals. They're patriots. So many of them serve in our military. Most of them are in Robeson County, and I am just so proud of this. Senator Tillis did great work, and everyone saw, I mean, this was other tribes around the country having to make sure that their member of the Senate understood this. But I am so proud of getting this passed. This is great news. President Trump will sign it into law today. And this is great news for North Carolina and the 60,000 individuals that have been pulling for this for a long time.
Yeah, why did it take such a long time? And why on the defense bill rather than a standalone?
Well, it's a must-pass bill because for the defense of our nation, and I think because there's so many great patriots that serve in our military from the Lumbee Tribe, I think it's very relevant. But it's again a must-pass bill. It's the right time, and you have to find the right vehicle for that legislation to travel on. And this was the right vehicle at the right moment and for the right tribes. But there's a lot of competing interest. Other tribes that may feel competitive, but again, most of the tribes out there were very supportive all around the country, and we're very pleased with that.
Yeah, this defense bill authorizes $765 million now for North Carolina military installations. What do you think is going to have the biggest impact for the Tar Heel State?
Well, I mean, America looks to their 911, and that is right there at Fort Bragg with our 82nd Airborne. Our special forces are based there. We've got pay increases for our troops and for all of our warfighters. This allows them to purchase new systems to get rid of outdated systems, upgrades for our aircraft, better facilities, pay raises, and I mean, this just does so much to invest for us. We have to deter China. I mean, that's not just for North Carolina, that's for the whole country. That's one of our great adversaries in this age, and so we have to make sure we continue to invest in our military so we can protect our freedoms here.
Yeah, you champion an amendment that will seize Iranian weapons and then send them to U.S. military partners. Explain how that works and why it matters.
Well, we see if they're passed direct from Iran or through proxies like Houthis, if those are captured on the sea or over land and shipping, we can capture those and send those to our allies, those that value freedom in the Middle East and around the world. That way they're not just laying dormant, they're not just destroyed, they're put to good use for the purposes of freedom. And so that makes it clear. It had been bogged down legislatively for that to happen, and this fixes the problem.
The NDAA also does include language that eliminates DEI initiatives and critics saying that diversity is the strength of the military. How do you respond to that?
I would say we want a meritocracy, those that are the best and believe in the values of our country. And what we're seeing since the beginning of the Trump administration is recruiting is up. The Marine Corps has always hit their numbers, but the other branches have had real struggles because they've lost their focus on what the military is about. And so we're seeing people from all sorts of backgrounds and all sorts of racial diversity. We're seeing that still. But the focus is not diversity. The focus is lethality for our military. So it's still one of the great levelers of society and the military. And I'm so proud of what the warfighters do. But let's keep the focus on protecting the freedoms of our country. And let's make sure that we're lethal and that we're strong. And if we focus on that, you're going to have people from all sorts of backgrounds, whether it's in our academies, or whether it's enlistment, or whether it's at an officer level or ROTC. These are the best and the brightest. They come from all sorts of backgrounds, but let's remember that the focus is on military strength.
I want to change gears right now. Something reported out of Washington, of course, former Congressman Mark Wheeler, nominated by President Trump back in April to now 8 months later, still waiting for a nomination or a confirmation hearing, rather, to be the ambassador at large for international religious freedom. Is it true that you would vote for him if the vote were to come up to the floor?
If he's on the floor, I would do that favor for the president. He's asked me to do so. But I would also say, let's, to the committee, which I'm not on the Senate Foreign Relations Committee, do your homework and look closely. But let's look at the purpose of that ambassadorship and look at the body of my work. I helped to get the hostages home. I've worked on Nigeria. I've supported religious freedom around the world. It's been a significant part of my time in the Senate for the last 3 years. If you look at my theological training, I've been to seminary. I was involved in campus ministries in college. So it's obviously important to who I am and what I do here in the U.S. Senate. So I would just say the role is very important, and we need a serious person that fills that role.
I want to understand the legislation that related to the Rotor Act. You're one of the original supporters and co-writers of that, and help our viewers understand where that's from and where it stands today.
That was Ted Cruz legislation on the Commerce Committee. And if you go back to January 29th of last year, the horrible accident in the D.C. area between a Black Hawk and a jet coming in, an American Airlines aircraft coming in from Wichita. It was a Charlotte-based flight crew, and our hearts are broken. Those families were with us yesterday in the committee as we talked about air traffic safety and passenger safety. This requires ADS-Bs to be turned on, which is a satellite signal that sends out from an aircraft, and other aircraft, if they have ADS-B in, are able to receive it. So there's been a habit of turning that off from our military in complex airspace, such as the DC metro area. And this requires that to be turned on so that those aircraft can be identified and located. It requires a certain amount of coordination between the Department of War and air traffic control. So it's great legislation. It will improve passenger safety. And I wish we'd have had that in place over a year ago, and we would have had 67 lives saved.
All right. Senator Ted Budd joining us for a special conversation on a lot happening as we close out 2025. Thank you very much. Happy holidays to you, and we'll see you in the new year.
Thank you so much.